Hey everyone, Dr. Charlie Johnson, physical therapist, and the purpose of today's video is just a quick video to share with you guys the system that I'm using to help train the physical therapy aides in the physical therapy practice that I'm working. This is a good video for other business owners looking to implement systems into their practice. This is an interesting system that I found very helpful, and or also new grads or anyone looking to improve kind of their subjective examination taking skills. So with that being said, the way that the treatment or the treatment model in our clinic works is that we are divided into teams of 3, so to speak. So I, for example, would be myself, a physical therapist, paired with a physical therapy aide and a physical therapy assistant. The way that it works is that when somebody comes in for an evaluation, the physical therapy aide and or physical therapy assistant will go out, introduce themselves to the patient, welcome them, kind of the first point of contact, and bring them back to the room. And along the way, they're gathering information. This way, after the patient is brought back to their room, the physical therapy aide comes back and fills in the physical therapist on a little bit about what could be going on with the patient. So just a quick system that seems to be really helpful for the physical therapy aides that I'm working with in my practice. So I'll share it with you here. Okay, so here it is. Here is an over-the-shoulder view of and a quick brief look into the system that I have taught to my physical therapy aides to help them more quickly and accurately collect information that is helpful to then relay to me, physical therapist, before going into the evaluation. So it's just a nice, efficient way to collect some information, before you head in and meet the patient. So here it is. It's a quick acronym that just acts as a trigger to help you or to help your physical therapy aide ask the right question. So here it is. Okay, so the acronym you can see here is SINSAE. I'm going to go through one of them, or each of them, one at a time. So the first S is severity. Easy way for your physical therapy aide or whoever may be bringing the patient back to determine the patient's severity is to ask them, using a numeric pain rating scale, what their pain level is. So a question would sound like, okay, Miss So-and-so, on a scale of 0 to 10, 0 is no pain at all, 10 is the worst pain imaginable, or some people say even the emergency room. How much pain do you have right now? You could also do not only current pain level, but pain level on average or at worst. So first S in the acronym SINSAE is severity. The next one, I, is irritability. So you want to make sure that they ask the patient, okay, well, Mrs. So-and-so, when you have X, Y, and Z pain, when the pain comes on, how long does it last? So is it something that just goes away right away, or is it something that lasts for an extended period of time, and if so, how long? So severity, irritability. The N is nature. Nature is simply asking the patient to describe their pain. So they may say things like, oh, it's sharp, burning, shooting, I have dull pain, numbness, tingling. Anything like that is, again, helpful just to get a quick snapshot of what's going on with the patient. The next one is kind of two-toned. It's stage and stability. So we want to know what type of issue we're dealing with. Is this with regards to stage, is this an acute, is this a subacute, or is this a chronic condition that's been around for a while? Stability, a simple question to determine stability would be, since this pain has started, would you say that the pain is staying the same, it's getting better, or it's getting worse? Just kind of gives you an idea as to where the patient perceives their pain to kind of be headed. So the A is aggs. So what things make it worse? So what are the aggravating factors with regards to this patient's condition? And then the E is for ease. So aggs, what things make your pain worse? Ease, what things make your pain better? Again, this is a system that I've taught to my physical therapy aides to kind of streamline the process when they bring the patient back, because simply when they have reviewed all this information and gone through this with the patient, I ask them before heading into the room, to kind of review this with me, and it really gives me a head start on what I'm thinking and where I can quickly and efficiently get through my evaluation. So if you like what I've shared and you want to hear more or you have any questions about it, I'd love to hear from you below. So thanks so much, everyone. Take care. Bye.